Hey guys, Dr. Beddoe here, and today I want to go over some stability and strengthening exercises. I know that my video yesterday was talking about meniscus injuries. I know I had a few other videos talking about different knee pains, different things that a lot of my patients are experiencing. So I want to give you some exercises today to kind of cover what you guys can do if you guys are experiencing medial knee pain, lateral knee pain. Maybe you guys have a meniscus injury on the lateral 1/3 that your doctor, your primary care physician is saying that you guys want to go to rehab to be able to recuperate and strengthen. So I want to go over some different exercises that you guys can do to start really strengthening the joints above and below the knee, really focusing on the knee joint and also the hip joint, because the hip joint is really what creates a lot of stability in the knee. So it's really important to attack the hip when addressing knee problems. So I think that the first ones that everyone is going to be, more used to, we can go over just strengthen the quads and the hamstrings. When it comes to knee injuries, these are not the muscles that we want to focus on, but they're important muscles to be able to incorporate into your workout routine or into your rehabilitation program. So with a TheraBand, I'm not going to go through exactly with the knee, but you're attaching it down low and you're going to kick out to work on the quads, back and forth, and attaching it up and nice and high, and then pulling straight back down to be able to work on the quads and the hamstrings. But the most specific exercises are going to be the most important for knee pain and knee joint health. Is be more focusing on some of the frontal plane muscles, like the TFL going down the side, and some of the external rotators in the frontal and also the transverse plane of motion, which is going to be more gluteus medius. So I want to give you a few exercises that are going to be focusing more on those muscles today. So one that I like to do before I go for a run, it's a modified clamshell. So if you guys are not familiar with the clamshell, you can Google it, look it up. But a modified would be to get into a seated position. I know I'm not really seated right now, but get in a chair, get on the couch, get a TheraBand, and rotate out. Now you want to keep your ankles together, and you guys want to rotate out to the side. And you really want to do this until you really start to feel it in the side of your hip, right here. So that's working on the gluteus medius muscle. This muscle is really the main stabilizer for your knee, and be able to protect it from diving in, right? So if you guys are getting a lot of the knee pain, medial knee pain, lateral knee pain, a lot of it's going to derive from a weak gluteus medius muscle. And so really just work this out until you start to feel it back there. Turn this muscle on. Oftentimes with people that are not working this muscle out, it's not going to be activated, and therefore, it's like a light switch. If it's turned off, there's no light in the room. So you want to turn this muscle on so when you guys are walking, running, working out your legs, doing leg day, this muscle's activated, and so it's protecting your knee. So the next muscle we want to work on, we want to put the TheraBand around your ankles. Now once it's around your ankles, you guys can hold on to something. We're going to go straight out to the side. Nice and even. Straight out. So, if we're not bending our knees, if we're not rotating out, if you're not pointing your toes, which I don't want you to do, but you're keeping it nice and straight, this is really going to work on tensor fascia lata. So the TFL, like I've mentioned in a few other videos, goes into your IT band, right? And so the TFL is up here on the hip, it comes down, the IT band is going to go and insert above the knee and below the knee, but it's going to be a lot of stability into this plane of motion, right? The frontal plane of motion. And so to work it out, we're going out to the side. Now this is going to be more for a rep count. Try to hit 10 or 12, and then you're going to switch to the other side. Having resistance all the way through, going to the top end range of motion. You should start feeling it towards the end. And again, you guys can modify this by using a light resistance TheraBand, a medium resistance TheraBand, or a hard resistance TheraBand. And then we'll switch to the other side. Five, 6, 7, 8, 9, 10, 11, 12. Good, so now we're working on TFL. Try to repeat that 2 or 3 sets. We're just doing 1 today. So for the next exercise, really start targeting gluteus medius, glute min, some quad activation, but more of a dynamic movement. Bring the TheraBand up, right here. And these are called monster walks. So you guys are going to do a nice quarter to a 1/3 squat, not all the way down. You guys are going to take a nice wide stance, okay? And you guys are going to go laterally. Stay nice and low. Make sure that your head's staying nice and low. Then we're going to come back. So do this, and you guys are going to start feeling it a little bit in your quads, but you really should start feeling it back here in your gluteus medius muscle, right? So this is more that dynamic movement. We're not just isolating the glute med, we're incorporating it with some glute max, glute med, glute min, quads, making sure that your back is nice and up. Don't bend down like this. Keep it nice and high. Get a nice little arch in your back. Now, if you guys have been to a physical therapist before, and you guys have been doing these exercises, or maybe you guys are a little more higher end athlete, you guys are focusing on these exercises for sports, you guys also might see it being performed this way, right? Where you're coming forward. But still, the key is to keep tension through your hips. Be working that gluteus medius in more of a dynamic way. You really start stabilizing the knee by really addressing the hip joint and some of those muscles that cross that knee joint. Take the TheraBand off. You guys should be feeling it in your hips, but then hopefully that muscle is now activated. You guys are getting the knee nice and strong, getting the hip nice and strong. Let me know if you guys have any questions or comments. Please comment below in the comment section. Please subscribe, as I release videos. They're gonna be helpful to you and to your health and overall good and helpful tips. Have a good rest of your day.